Welcome back. My name is Priti and you're watching a special episode on health and wellness. And in this episode, we're talking about osteoarthritis of the hip and other hip joint disorders and how to efficiently take care of these conditions. Now, joining us is Dr. John T. John. He's from Lourdes Hospital, Kochi, and has vast experience in this field. Dr. John, welcome to our show. Now, isn't young adults complaining about hip joint pain kind of unusual? And what are the causes that lead to this condition amongst the young?
It is not that uncommon for youngsters to experience hip pain because with the present scenario where the youngsters are really active, you can have different reasons of developing pain in the hip. Like most common cause of hip pain in young is like severe trauma, trivial fall or contusions or sprains. Especially when they are playing and active, or that time you can develop some labral tears or something which is something like a meniscus, like a washer inside the hip joint. Then the next common cause of hip pain will be rheumatological issues like rheumatoid arthritis, ankylosing spondylitis, and then comes the infections, which is also very common in India, like TB. Septic arthritis. So it's not that rare to have hip pain in young.
Now, Dr. John, often it happens, especially in young adults, that you have pain or you kind of experience certain symptoms, but you have a tendency being young that for 2 days if the pain is there, you take care of it, and when it goes, you're all right, you just carry on with your life. But I'm sure there are implications of avoiding these symptoms, right?
If you ignore, especially in case of an infection, it will be very devastating to have, like a TB or a infections inside the hip joint is missed. If you take an early treatment, you can almost have a normal life. But if you don't treat it properly at proper time, then it can lead to severe damage and severe loss of function of the hip joint. And especially in other cases like rheumatoid arthritis and rheumatological issues, there are now lot of advances in medicine. So we can give it drugs and like tablets or injections that can really prevent the devastating complications from happening.
Now, Dr. John, studies indicate that 19.3% of young Indians are obese, and by 2025 it is believed that India will be the second largest country for childhood obesity. Now these numbers are very alarming, and do you think that this can actually lead to further increase in hip disorder cases?
Definitely. If you look at it, I think that whatever the projection you are saying is 19.23 will be less, it will be more than that. So when a person is walking, you have got the entire weight of that patient moving in along the hip, so it can lead to damages. So if they like have small twist or sprains, that can be in an obese person, they may recover very slowly. And obesity can not only in hip joint, it can affect the knee joint more. So it can affect the knee joint and hip joint. Definitely it will be a big problem later on if we go on and having this high BMI patients.
Now, doctor, if an X-ray shows that a joint is impacted due to arthritis and is causing pain, what could be the long-term complications of this condition?
Once whatever you are saying, like an impaction of the bone is happened, means it is like the end stage of arthritis. In the end stage of arthritis, most of the time we don't have much medical or the tablets to treat them. You have to undergo a surgical treatment. That is mostly a hip replacement. That is the damaged part of those bone is removed, and we will put the artificial implants. That is, an artificial hip joint will be kept instead of the natural hip joint.
Now, doctor, once diagnosed, what are the steps one should take in the early stages of this condition?
In the early stages of the disease, the most important thing is to identify the problem, treat the problem properly by a proper person. most of the time, in India, what we find is that they will be going to different alternative forms of treatment, and they might take advances of layman, and by the time it reaches an expert, it will be end stage. So if you can identify this problem in the early stage, then we can really avoid the future complications from happening.
Now, what is AVN that we've heard of, and why does it happen?
AVN means avascular necrosis, and it is most commonly affecting the hip joint. Avascular necrosis means that it is the blood supply of the hip joint is totally gone. In that case, after a period of time, the bone will start disintegrating, and this disintegrated bone can lead to arthritis. And slowly the arthritis in these early stages, you can treat with a smaller surgical thing, but once it is advanced, then you have to again go for a hip replacement.
Now, in severe and chronic AVN cases, what are the treatment options that one has?
In a severe AVN cases, that is avascular necrosis, that is after stage 2, that is from middle grade to stage 4, the treatment is stage 3 and stage 4 is only total hip replacement. There is no other treatment which is successful at present. So there are, depending upon the age of the patient, we can have different forms of hip replacement. Like in this case, you can see this is a hip replacement which we are talking. So this is the hip joint where you have, this is the socket which can be replaced. This is the bone which is replaced. Then we are putting it inside. This is a hip joint. So here you can see a pink kind of a thing. That is a small ball inside. That is a ceramic hip joint. So these two will give us a good result. So we might get around 80% success for 25 years.
Now, what should a chronic arthritis or AVN patient expect post surgery, and also what are the precautions one should take post operation for a better surgical outcome?
If you look at it, a hip replacement is one of the most successful treatment you can have, where the orthopedic surgery has found. And in hip replacement, it is the patient satisfaction is also more than knee replacement. And if you look at a hip replaced patient successfully done, you hardly we may be able to make out itself that patient is having some problem. So a hip replacement patient should be really, after the surgery, he should be able to walk, and he should really do all the exercises and physiotherapy regimen which has been followed. But we have to be certainly little bit cautious, especially in India where we squat a lot. That means we sit on the floor. For praying, for toileting purpose, for eating, we sit on the floor. But generally we tell them to avoid these kind of extreme bending of the hip joint after hip replacement. But some people, they won't comply to all these requests, and they may continue to do so. In those patients, you might go for an early failure.
Now, doctor, my last question: are patients advised an exercise regime post operation for faster rehabilitation or physiotherapy sorts?
Yes, now the in thing in hip replacement surgery or any joint replacement is an accelerated physiotherapy regimen or a rehabilitation program where the patient is discharged within 72 hours. So by after surgery, the evening itself, the patient is made to stand and walk, and next day he will be mobilized and he will be walking inside the room, and the third day he will be walking out of the room and going home. So this kind of an accelerated physiotherapy regime is now widely popularized abroad. Now it is happening in India also, because as our patients' demands are also increasing, this kind of accelerated regime are useful. And lot of exercises is required. If we are not properly strengthening our muscles around the hip joint, this can lead to early failure, because more effect will be coming onto the artificial joint surface. So if your muscles are strong, your hip will, the artificial hip will get more rest. So definitely a physiotherapy and rehabilitation has got a very big role in the success of a total hip replacement.
Right. Thank you very much, Dr. John, for your time. So that's all we have for you in this week's episode. This was a special on obesity. We spoke about osteoarthritis of hip and other hip joint disorders. What are the treatments that are available? How can one go about it? What are the things that one needs to keep in mind before the surgery and after surgery? We really hope that it's been useful to you. And like we always say, prevention is of course better than cure. Take good care of yourself, and we'll see you in the next one.